Have you ever tried to fix something, like really tried, and just hit a wall? Like you thought you knew how it worked, but you just couldn't make it happen?
Oh, all the time.
Mm.
It's like that feeling when you watch someone handle a situation so smoothly, and you're
Yeah.
just standing there like, how did they do that? I could never.
Exactly. So what is that difference between knowing about something and actually being good at it? And sometimes it feels like we even mistake confidence for actual skill. Like we think we're good at something, but are we really? Or maybe we see someone else who seems so sure of themselves, but do they actually know what they're doing?
Right, right. And that takes us to what we're diving into today, which is clinical skill teaching. We've got some really interesting material here that gets into the nitty-gritty of what makes for effective skill development and what doesn't.
So we're going to try to figure out what even is a skill? Like how do we define it? And then how do we teach it, especially in high pressure fields like medicine? And what are the roadblocks that pop up along the way?
Totally. I think what we're aiming for is to understand the core principles of how real expertise is built, why it's so important, especially in these kinds of fields, and how we can all get better at learning and practicing whatever it is we do.
Absolutely. And before we jump in, we want to give a huge shout out to London Heartbeats Academy in the UK for their amazing support.
They've got an incredible selection of courses, over 150 of them, all super popular. So if you're looking to learn something new, definitely check them out.
And don't forget to follow them on Facebook, Instagram, and YouTube to stay updated on all their latest offerings. They've got free, regular updates, and you won't want to miss out on any of their awesome discussions.
All right, let's get down to business. Starting with the basics. What exactly is a skill?
Yeah, like what are we even talking about when we say that word?
Well, according to the material we have here, a skill is defined as an ability, a capacity you develop through deliberate, consistent effort. It has to be intentional, systematic, and you can't just dabble in it. You've got to stick with it.
So it's not just about passively absorbing information like reading a textbook or listening to a lecture. It's about taking that knowledge and actually doing something with it.
Precisely. And the goal of developing a skill is to be able to handle complex tasks, even whole job functions, smoothly and without breaking a sweat.
Like a chef who can whip up a 5-course meal without even looking at a recipe.
Exactly.
Mm.
It's not just about following instructions. It's about having a deep understanding of the principles involved and being able to adapt to any situation. And our sources break down skills into a few different categories. The first one is intellectual skills.
So what makes a skill intellectual?
It's the ability to think effectively within a specific field. Knowledge is obviously important, but it's how you use that knowledge that makes it a skill.
Can you give us an example?
Sure, imagine you're a doctor interpreting a liver function test results for a patient with jaundice. You need to know what those test results actually mean, but the intellectual skill is in analyzing the specific patterns in those results for that individual patient to make the right call.
So it's like problem solving, right? It's not just about knowing facts, but about using those facts to understand what's happening in a real life situation.
Exactly. Then we have psychomotor skills.
That sounds complicated.
Not really.
Yeah.
It's basically your manual abilities, the physical coordination you need to do things.
So like playing the piano or doing surgery?
Yes. Things that require precise hand movements. Like, you can read all the instructions you want about how to draw blood, but the psychomotor skill is in the actual doing the hand-eye coordination, the feeling of the needle, the finesse of the movement.
Right. You can't learn that just from a book. You need to actually practice.
Absolutely. Then we have communication skills.
Which I guess is pretty self-explanatory.
Yeah, but it's more than just talking. It's about interacting effectively with other people in a specific context. And a huge part of it is your attitude.
So how you say things is just as important as what you say.
Exactly. Think about it. If you're a doctor trying to encourage a patient's family to donate blood, you need to convey the importance of it, but also be empathetic and build a rapport.
Right. You can't just rattle off statistics and expect people to be moved.
Exactly. And the last category is team skill.
So working together.
Yep. It's about being able to collaborate effectively with others towards a common goal. Like working on a project together, or a surgical team operating on a patient. Everyone has to know their role, communicate clearly, and work in sync.
Makes sense. And one thing that really stood out to me in this material is that the ultimate goal of education, especially in a professional field, isn't just about acquiring knowledge.
Totally agree. One of the visuals actually states it really clearly. The end of education, especially professional education, is not knowledge, but appropriate action.
It's about being able to put what you know into practice, right? To make the right decisions and actually do the right thing in a real-life situation.
Absolutely. But the thing is, the traditional way of teaching these practical skills, especially in medicine, is often based on what's called the master-apprenticeship model.
Which is basically see one, do one.
Yeah. The experienced practitioner shows you how it's done, and then you try to copy them. But our sources point out some serious limitations with this approach.
Like, you can watch someone do something a million times, but that doesn't mean you can automatically do it yourself.
Right. Like, I can watch all the YouTube videos in the world about fixing a car, but that doesn't make me a mechanic.
Yeah.
And the problem is, when you're just observing, you're not really actively engaging with the skill. You're not breaking it down, understanding the decision-making behind each step, or thinking about what could go wrong.
So you're just passively watching, not really learning how to actually do it.
Exactly. And in this master-apprentice relationship, the master is the one who's directing everything, showing you the ropes, giving you feedback.
And the apprentice, or sometimes called the disciple, is the one who's supposed to be soaking it all up.
Yeah. They watch, they listen, they try to imitate, and hopefully they get the master's approval. But the thing is, there are a lot of problems with this model, especially when it comes to teaching clinical skills.
Like what?
Well, for starters, there's often a lack of clear objectives.
Like, what are you actually supposed to learn?
Exactly. If the teachers don't define what skills the students should have by the end of their training, it becomes almost impossible to teach them effectively, or to even know if they've learned anything.
It's like trying to navigate without a map. You have no idea where you're going or how to get there.
Exactly. And then there's the issue of class size.
Too many students, not enough teachers.
Basically, when you have huge groups of students, it's really hard for instructors to give everyone individualized attention, enough practice opportunities, and personalized feedback.
It's like trying to learn to swim in a crowded pool.
Right. And on top of that, the teachers themselves are often incredibly busy with their own patients and clinical work. They just don't have the time to dedicate to teaching.
So teaching ends up being this extra thing they have to squeeze in, even though it's so important.
Yeah. And then there's the issue of student motivation. Sometimes students just aren't that interested in developing practical skills. They're more focused on passing exams, which are usually multiple choice, and focus on theoretical knowledge.
So they prioritize cramming for tests over actually learning how to do the thing.
Exactly. It's like studying the rules of basketball without ever actually playing the game. And another big problem is that clinical skills often aren't clearly defined in the curriculum.
So what you learn might depend on who's teaching you.
Exactly. There's no standardization across different schools, which can be really confusing for students. It's like learning different rules for the same game depending on which team you're on.
Right, and then you have the issue of information overload.
Oh yeah, in many medical schools, students are bombarded with so much information that there's just not enough time for them to actually practice their skills. They're too busy memorizing facts.
It's like trying to drink from a fire hose. You're getting a lot of information, but you can't absorb it all.
And then there's the lack of adequate supervision and feedback.
Which is crucial for learning any skill. You need someone to guide you and tell you what you're doing right and wrong.
Absolutely. But in many medical schools, there just aren't enough opportunities for students to get that kind of personalized attention. They're often left to figure things out on their own, which can lead to bad habits and a lack of confidence.
And on top of that, there's not enough emphasis on reflection and discussion.
Yeah. Students need time to process what they've learned, to think about their experiences, and to talk things through with their peers and instructors.
It's like trying to solve a complex puzzle without discussing it with anyone. You might eventually figure it out, but it'll take you a lot longer and you might miss some important insights.
Exactly. And unfortunately, in many medical schools, clinical teaching just isn't given a high enough priority.
Like it's seen as less important than research or other academic activities?
Yeah. Which is a shame because it's so crucial for producing competent doctors. And this leads to the big question posed in our materials. Are we really producing doctors?
It's a pretty provocative question. It makes you wonder if our current system is really setting students up for success.
Right. So then the question becomes, where and how should we be teaching these skills?
And our sources suggest two main settings,
The first is the workplace itself, the actual clinical setting.
where the real action happens.
Exactly. But the other setting is the skill lab.
Like a controlled environment where students can practice without any real-life consequences.
Exactly. One of the visuals even shows a picture of a dissection hall with tables, equipment, and, well, cadavers.
It's a place where students can get hands-on experience without worrying about harming a real patient,
And within the skill lab, there's a lot of talk about using simulation as a teaching method.
which basically means using technology to recreate real-life scenarios.
Exactly. And there are a lot of advantages to simulation. For starters, it's completely safe.
No risk of hurting anyone.
And it allows for deliberate practice. Students can focus on specific skills, repeat them as many times as they need, and get immediate feedback.
It's like having a personal trainer for your clinical skills,
And another great thing about simulation is that it's a safe space to make mistakes.
which is essential for learning.
Absolutely. In simulation, you can mess up a procedure 100 times and it doesn't matter. You learn from your mistakes and get better.
You wouldn't want to do that with a real patient.
Definitely not. And simulation also allows you to practice rare or dangerous situations that you might not encounter in real life. Like, what do you do if a patient has a severe allergic reaction? You can practice that in a simulation without putting anyone at risk.
So it's a really valuable tool for preparing for all sorts of scenarios.
And another advantage is that simulation can be used to teach both technical and non-technical skills.
What's the difference?
Technical skills are things like performing a procedure, while non-technical skills are things like communication, teamwork, and decision-making.
So simulation can help you develop the whole package.
Exactly. And lastly, simulation allows for objective assessment. You can use standardized scenarios and scoring systems to measure how well students are performing.
So it's a really powerful teaching tool.
Absolutely.
Yeah.
But our sources also point out that simulation has its limitations.
Like what?
Well, the main one is that it just can't fully replicate the real-life experience.
It's not quite the same as dealing with a real patient.
Right. In simulation, you don't have the same emotional stakes, the same unpredictable factors, the same complexity of human interaction.
So while simulation is a great way to practice, it's not a substitute for real-world experience.
Exactly. And another potential downside is that if students rely too heavily on simulation, they might become overconfident and not be prepared for the challenges of real-life practice.
It's like learning to drive in a video game. You might think you're a great driver, but then you get behind the wheel of a real car and realize it's a lot harder than you thought.
And another limitation is that simulation can't always capture the full consequences of your actions.
Like, in a simulation, you can make a mistake and nobody gets hurt. But in real life, your actions can have serious consequences.
Right. So while simulation is a valuable tool, it needs to be used in conjunction with real-world experience.
Absolutely. And speaking of real-world experience, our sources present a really interesting model of skill development, which outlines the stages a learner goes through.
Yeah, it's like a roadmap from being a complete beginner to becoming a master,
And the first stage is the novice stage,
which is characterized by unaware incompetence.
meaning you don't even know what you don't know.
Exactly. You're clueless about your own lack of skill.
Like you think you can speak French fluently, but then you go to Paris and realize you can barely order a croissant.
Right, and then you move into the apprentice stage, which is marked by aware incompetence.
So now you realize you don't actually know what you're doing.
Exactly. You become aware of the gap between your current abilities and where you want to be.
It's like that moment when you realize how much you still have to learn.
And that realization can be kind of daunting, but it's also a necessary step in the learning process.
It's like climbing a mountain. You have to first acknowledge how high the peak is before you can start your ascent.
Exactly. And then you reach the journeyman stage, which is characterized by conscious competence.
So now you can actually do the thing, but it takes effort.
Right. You have to consciously think through each step.
It's like learning to ride a bike. At first, you have to think about pedaling, steering, and balancing all at the same time, but eventually it becomes more automatic.
Exactly. And that's the final stage, the master stage, which is characterized by reflex unconscious competence.
So now the skill has become second nature. You can do it without even thinking about it.
Right. It's like driving a car. You don't have to think about pressing the gas pedal or turning the steering wheel. You just do it.
It's become automatic.
Exactly. And our sources actually illustrate this progression with a U-shaped curve.
Showing how your skill level changes over time.
Right. With ineffective learning, you might move from unaware incompetence to aware incompetence and get stuck there.
So you realize you're not good at something, but you never actually get better.
But with effective learning, there's a dip at first as you become aware of your incompetence, and then a steady climb as you progress through conscious competence to unconscious competence.
So the key is to find effective learning methods that help you move up that curve.
Absolutely. And our sources also talk about how the relationship between the master and the apprentice changes as the apprentice becomes more skilled.
So at first, the master is very hands-on, providing a lot of guidance and feedback.
Right. But as the apprentice becomes more competent, the master starts to step back and give them more autonomy.
It's like a parent teaching their child to ride a bike. At first, they hold onto the seat and run alongside, but eventually, they let go and let the child ride on their own.
Exactly. And this idea of progressive skill development is also linked to something called the innovation maturity progression model, which is shown as a pyramid.
And this model shows how individual skill development contributes to the overall growth of a team or organization.
Right. As individuals progress from novice to master, they become more committed, better trained, more experienced, and better communicators. And this leads to repeatable success and continuous learning for the entire team.
So it's a win-win for everyone.
Exactly. And lastly, our sources outline some key steps for planning effective clinical skill teaching.
Starting with defining the objective.
Right. What specific skills do you want the learners to acquire?
And then you have to consider the setting.
Who are you teaching, where are you teaching, and how are you teaching?
And finally, you have to execute the plan.
Which means actually implementing the teaching session and providing feedback to the learners.
So it's a cyclical process of planning, executing, and reflecting.
Exactly. And I think the main takeaway from all of this is that true education, especially in professional fields like medicine, isn't just about stuffing your head with knowledge.
It's about being able to use that knowledge to make a difference in the real world.
Exactly. It's about bridging the gap between knowing and doing.
And as we wrap up this deep dive, I think it's worth asking ourselves, what skills are we consciously competent in? What skills are we working towards mastering?
And how can we all get better at learning and developing new skills, no matter what field we're in?
Thanks for joining us for this deep dive. We hope it's given you some food for thought.
And we hope you'll continue to explore the fascinating world of skill development with us in the future.